The first principle is that we will only consider, and we have only considered, risks and benefits that actually accrue to children and young people 12 to 15. So we have not considered any benefits that might accrue to adults or anyone else. This is purely about children of the age group we're talking about. That was, will vaccination reduce the disruption and therefore reduce these very significant negative impacts? And our assessment is the answer to that is yes. It will reduce education disruption. We do not think that this is a panacea. This is not a silver bullet. It's not a single thing that on its own will do so, but we think it is an important and potentially useful additional tool to help reduce the public health impacts that come through educational disruption.
Over 2,000 children were studied, 2,000 aged 12 to 15 in the trials. Immunogenicity studies showed similar neutralising antibody levels in adolescents as in young adults. And these results, together with the clinical trial data, showed a very high level of short-term efficacy, consistent with that seen in adults. And in fact, there was evidence that the vaccine provides protection even before dose 2. These are extremely positive results.
And I think that our view, and this is a professional view, so this is the view I would say of the great majority of doctors and public health professionals, is that these two are not in conflict. What JCVI said is there is a marginal advantage, but by their assessment, that was not sufficient by their ordinary standards to recommend it, and quite appropriately, they kept to their independent view. They suggested further things, and what we've done is we've added in some wider considerations, as JCVI suggested, and I don't think, in our view, certainly as chief medical officers, and Professor Lim may want to comment as chair of JCVI, we do not see a conflict between these. We do not think this is going to interfere with the booster jabs for older people. We have plenty of vaccine stock for the relevant vaccines for these, and they're being deployed by different mechanisms. One is through a school mechanism and one's more widely. So I do not think that we're concerned about that. We are confident about reducing disruption. We are also confident this will not eliminate disruption. And that is very much central to the way we want to present this information.